Okay. All right. Oh, here we go. 4, 3. Okay. Good morning, everyone. Good morning. Good morning. Welcome to the fifth annual Black Maternal Health Conference. My name is Dr. Muta Onukaga. I'm the founder and leader of this conference. This is our fifth year. I'm also the Julia A. Okoro Professor of Black Maternal Health, and we are so excited to have you in the room with us today. For those of you that have been to our conference when it was in person, I will miss walking around and chatting with all of you. Hopefully, we'll be in person again next year. But even with that, today's virtual platform is going to give us an opportunity to interact. You're going to hear from some amazing speakers. Introducing the CMS administrator, Mrs. Chiquita Brooks LaShore, in a moment. I really want to thank all of our amazing sponsors for this conference, our gold sponsors, our ally sponsors, Organon, Neighborhood Birth Center, Robert Wood Johnson Foundation, and March of Dimes. Thank you so much. Today's conference would not be possible without our sponsors. Listen, we have over 1,680 people registered here today. An incredible turnout for this conference. It's one of a kind, and I hope it will leave you more knowledgeable, more excited, and more prepared for the work that you're doing. I would be remiss if I did not start off with a moment of gratitude, a note of gratitude to my amazing team. Thank you to my conference organizer and project manager extraordinaire, Judith Genty, our social media and marketing consultant, Marlene Edmond, all of our amazing volunteers and their respective committee chairs, marketing committee, Lily Snape and Megan Lamb, speaker committee, Tiffany Vassell, program committee, Tia Bellatot, sponsorship committee, Lily Schneider, logistics committee, Raya Barnes, the entire Mother Lab team, the entire March team, for months of hard work and preparation in making this conference a reality. The Mother Lab, Maternal Outcomes for Translational Health Equity Research Lab, March, Maternal Advocacy and Research for Community Health, Journal Club, all of these organizations are all asking the questions we have fought to bring attention to. And we are working to incite radical transformation in the field of maternal health. In February 2022, the CDC released updated information around maternal health from the National Vital Statistics System. And I'm here to tell all of you the data is getting worse. I wish I could say it's getting better, but the numbers are not. They're actually getting much worse. America is still in crisis. The maternal mortality increased from 20.1 deaths per live birth in 2019 to 23.8 in 2020. The Black maternal mortality rate is currently 2.9 times higher than the rate for non Hispanic white women. And this has been increasing for decades. Listen, these trends are not new. Adverse maternal health outcomes, especially for Black women, have been increasing for a long time. Federal lawmakers are now beginning to take notice of these disturbing trends in health disparities. One response was the introduction of the Black Maternal Health Momnibus Act of 2021 by some of our amazing speakers, including Representative Lauren Underwood and Representative Alma Adams, Cory Booker from New Jersey, and members of the Black Maternal Health Caucus. The Momnibus Act includes multiple bills. It's a suite of 9 bills related to addressing the Black maternal health crisis from various perspectives, including supporting social determinants of health like affordable housing and transportation, and also focusing on community based organizations, supporting coordinated care programs for veterans, improving data collection processes to better understand maternal health trends. Policy efforts are also happening in different parts of the United States at the state level, including the current work that is being done here through the Racial Inequities and Maternal Health Commission that I sit on, and the Massachusetts COVID-19 Maternal Equity Commission, of which I am a founding member. Today, we will have the opportunity to hear from experts in the field of maternal health policy, including our Massachusetts own Congresswoman Ayanna Presley, Administrator for the Center for Medicare and Medicaid Services, Ms. Shakita Brooks LaShore, Congresswoman Alma Adams, Dr. Judy Ann Bigby, Dr. Rachel Hardiman, Dr. Jaleesa Jolly, Dr. Margaret Larkins Pettigrew, Dr. Zaya Malawa, Massachusetts State Representative Liz Miranda, Dr. Viveka Prakash Zawiza, Congresswoman Lauren Underwood, and Senator Elizabeth Warren. Amazing lineup. With this inspirational lineup, as well as the presence and attention all of you are bringing here today, I am incredibly excited for the official start of the conference. Thank you all for being here today. And without further ado, I am honored to welcome you today to the fifth annual Black Maternal Health Conference. Now, I would like to introduce a very, very special speaker, Mrs. Shakita Brooks LaShore, the administrator for the Centers for Medicare and Medicaid Services, and the first Black woman in this position. As administrator, she oversees programs including Medicare, Medicaid, Children's Health Insurance Program, the healthcare.gov health insurance marketplace. A former policy official who played a key role in guiding the Affordable Care Act through passage, Mrs. Brooks LaShore has decades of experience in the federal government, on Capitol Hill, and in the private sector. As Deputy Director for Policy at the Center for Consumer Information and Insurance Oversight within the Centers for Medicare and Medicaid Services, and earlier at the Department of Health and Human Services as Director of Coverage Policy, Mrs. Brooks LaShore led the agency's implementation of ACA coverage and insurance reform policy revisions. Without further ado, it is my dear pleasure to welcome Mrs. Administrator Shakita Brooks LaShore. Thank you so much for being here.
Thank you so much for having me. And Dr. Ndidi and I had a chance to talk for a few minutes, and now we're best friends. I just love your energy. And I'm so excited to be here at this conference with all of you who have just been in the trenches for so long, and far beyond where I think we are today. Where there's just a different awareness and an appreciation at a senior level in DC about how we need to address this crisis in our country. And Dr. Ndidi mentioned just how much support there is across within Congress, where we have some real strong leadership from Senator Booker and Representative Lauren Underwood, Alma Adams, Robin Kelly. I got the just the privilege and the pleasure of being, as you know, with the vice president in December to really kick off this call to action around maternal health. And I can say with strong assurance to you all that her commitment to this issue, that the secretary's commitment, Secretary Becerra, and my commitment to really using all of our levers in the federal government to bring attention to this issue and to use our strong levers is really our priority. One of the things that I'm trying to do as CMS administrator is really use, I like to say it, the 3 M's, Medicare, Medicaid and CHIP, and marketplace coverage to drive health equity in a new way. We've, as a country, come a long way in terms of our coverage. So we at CMS now are responsible for over 150 million lives between our various programs. And what we're trying to do is make sure that coverage is meaningful and that we're using the full authority of our programs to try to improve health equity. It is the first pillar that we've announced as part of our 6 strategic pillars: improving health equity, addressing health equity, and maternal health. I don't know if there is a single issue that where the disparities are so more stark. And Dr. Ndidi highlighted the statistics. I don't need to do that for you all. But one of the things I try to highlight is this is not just an income issue. This is not something where it's only about a disproportionate resources. It affects women of all education levels. It affects women of all income levels. And, you know, I was on a panel a couple of months ago in Virginia when we were rolling out their extension of postpartum coverage. And I got to speak with many other experts, and one, a Black woman who's an OBGYN who has a podcast talking about maternal health, was just talking about her own experience, as well as those of her other colleagues at Duke who physicians themselves. So Black physicians who talked about their own difficulties. And I highlight that just to say how one of the things we're trying to do at CMS is really make sure we are incorporating the perspective of lived experience. And I think in maternal health, it's so key. So to really say this is an issue that is affecting women of color in all sorts of circumstances. So I just really want to mostly say how much I'm so grateful for all of the work that you all are doing to highlight this issue, to work on this issue, and just I will just briefly touch on some of the things that we are going to do. So as I talked about, we want to really make sure we're using all of our levers. One of the things I'm so proud about is that even though Medicare doesn't pay for a lot of births in this country, we are using our authority in the Medicare program to make sure that we are asking the right questions of hospitals. So, one of the things that we've announced is that we're going to be proposing a birthing friendly designation to hospitals to really ensure that they are working to improve maternal health outcomes. And we're starting with giving that designation to hospitals that enter into maternal health collaboratives that coordinate care. And we'll be continuing to look and explore other ways that we can require and support hospitals and other facilities that are moving to making sure that they are coordinating care and improving maternal health outcomes. Secondly, the Medicaid program is responsible between Medicaid and CHIP, the Children's Health Insurance Program, responsible for over 40% of births in this country. And so we are using that lever. The most important of those levers is postpartum coverage. And I think any of us who have been parents know, or worked with parents know that when you're juggling a new baby and the idea of having to switch coverage in the midst of all of the things you're getting used to is just one more thing that is a barrier to getting health care. And thanks to the American Rescue Plan, states now have the option to provide coverage for 12 months postpartum. And so we're strongly encouraging states. We've already gotten 4 states that have come in to extend coverage for 12 months. And there are over a dozen states who are talking with us to extend postpartum coverage. And we're really trying to encourage states to take up this option because many of the deaths and or morbidity really occurs not just right away, but during that somewhere between the 60 days and 12 months, which is why we're really encouraging states to ensure continuity of coverage. And that, of course, will help improve outcomes for the mother as well as for the child. And so that's one of our strongest pushes and something that you'll see us engaged in throughout throughout the next couple of months. Building on that, it's not just coverage. It's also about um, making sure that people receive the care that they need. And we are learning as we look through the data what steps states and providers can take to reduce these uh, these disparities. And so, one of the things that we've been engaged in as an agency is really working with states to tell them what we're seeing in the data and putting out more what we call technical assistance, really trying to work with the states to really share some of the learnings that we're finding as we comb through the data. And then finally, I'll just mention that we do have an innovation center where we're able to test new models. And that's also a place where we are continuing to try to learn what more we can do. Oh, and I forgot one of my favorite things, which is coordination of care and with our colleagues. So HRSA, which is another agency within HHS, funds a lot of our doulas and other types of initiatives. We're really working to make sure that we're bringing doulas into the Medicaid program, and so that's certainly an element to the work we're doing. It's a high priority from the vice president, which she has shared directly with me about really making sure we're incorporating doula care into whether women are delivering it in the hospital or other settings. And so that's another place where we are working not only with our agency, with the states, but also with our sister agency in HRSA to really try to make sure that we are coordinating care. So those are a couple of the things that we are trying to do at the federal level, and hopefully gives you a sense of just what a priority this is, how much action um, uh, we are engaging in, and really welcome additional perspectives and thoughts from you all, because you are the leaders in terms of the things that we need to do. So back to you, Dr. Ndidi.
Thank you, Administrator Brooks LaShore. Thank you. Thank you. You know, my heart is so full thinking about the remarks that you just gave, the incredible position you're in, the history that you've made, and frankly, just thinking about all the amazing thing your administration will do. So thank you for your remarks. I look forward to being in partnership with you, continuing this conversation, getting to know you better, and supporting your work. Okay, so everyone, we are going to head back over to the main stage now. And from there, you will be able to hear the remarks of our next session with Representative Lauren Underwood. Thank you so much and see you in the main stage.